So good afternoon. Today we're joined by Jody White, who's the CEO of Lawrence General Hospital. Thank you for being with us. And by Kate Walsh, who's the CEO of Boston Medical Center. Thank you for being with us to discuss the rising hospitalizations across the Commonwealth due to COVID-19. In a few minutes, they'll talk in more detail about what they're observing in their corners of the Commonwealth and how they're preparing to fight COVID. First, I want to give a quick update on the numbers. Yesterday, the Department of Public Health reported 1,184 new cases. The 7-day average positivity rate is 2.35%. Just over 47,000 new molecular tests were reported, and over 6.7 million tests have been administered to date. Back in March, we had the capacity to conduct about 2,000 tests a day. We're now conducting on average about 73,000 tests a day. And last week, we had our first day where we did over 100,000 tests. There are about 588 hospitalizations and 143 cases in the ICU. Like many other states and countries, we're seeing a rise in new COVID-19 cases and hospitalizations. Since Labor Day, cases have increased by over 300%, and in the same period of time, hospitalizations by nearly 200%. On Labor Day, the number of people hospitalized for COVID-19 was down to 178. Today, as I said earlier, that number's climbed up to 588 patients needing hospital level of care, and as I said before, 143 in the ICU. Statewide, the Commonwealth's hospital occupancy is up to 67%, and the ICU occupancy is at 50%. The trends obviously are going in the wrong direction and show no sign of changing. COVID-19 has now been with us for the better part of a year, and we've learned a lot about how to address this terrible virus. In addition to building a massive testing and tracing infrastructure, we've also executed on plans to better manage our healthcare systems during a pandemic. Our experience from last spring shows that creating enough space to safely treat COVID-19 patients and other patients throughout our healthcare system is the single most important aspect we have of navigating the pandemic as safely as possible. And being prepared for every scenario is critical. The COVID-19 command centers work side by side with our hospitals to plan for a surge, to expand capacity, and to set up alternative care sites. We hope we won't need to use many of those additional resources, but preparing our healthcare system now will help us keep schools open and our economy open and our healthcare system open as well. As everyone probably remembers, because of the surge in hospitalizations last spring, we had no choice but to restrict elective procedures and many other procedures, and some people didn't get more of the routine medical care that they should have had at that time. We're doing everything in our power to avoid that scenario happening again. With cases and hospitalizations on the rise, Massachusetts hospitals are preparing once again to meet the needs of COVID-19 patients. Together, our administration and Massachusetts world-leading hospitals have been preparing to meet that demand while still providing medical care for non-COVID patients. As part of that effort, on an as-needed basis, hospitals are prepared to make an additional 400 beds available by converting acute care beds to ICU beds. Also, as part of this effort to build even more capacity, this administration will once again begin to plan to stand up field hospitals. We're in the process of working with MEMA and with hospital officials to identify suitable locations to locate and staff facilities. Where and when these facilities are stood up will depend in part on available space and where the needs are. These field hospitals will be fully equipped with hospital beds, life-saving equipment, and medical supplies, and they'll be staffed by hundreds of medical professionals to care for patients around the clock. We'll have more details about where we plan these facilities to stand up later this week. Converting unused space inside hospitals and standing up field hospitals will obviously add capacity, but our resources ultimately will be limited. In other parts of the world, and right now in some parts of the U.S., despite all the planning, medical facilities are being stretched. When it comes down to it, controlling this virus depends in many ways on the everyday actions of everybody. Our Commonwealth has done incredible work to fight this virus since March, but recently folks have let their guard down. That's evidenced by the spikes we've been seeing in positive cases statewide. We know folks are tired of this. COVID fatigue is probably a new word in the Urban Dictionary. But COVID is merciless, and it will continue to grow and spread whenever it's given the opportunity. And we're asking all of you to keep that in mind as we all fight it every day. Wear a mask, wash your hands, practice good hygiene, socially distance. Last week, as you know, we unveiled targeted measures to make sure everyone puts their guard back up. And we asked the public to observe the stay-at-home advisory that's in effect from 10 p.m. to 5 a.m. Observe the new gathering limits, particularly for private residences, and avoid hosting get-togethers at home, and wear a mask whenever possible. Get tested if you feel sick. There are free testing sites statewide that can turn around a test result in 2 days. Collectively, all of these actions will help us keep moving forward with our lives, and it allows us to keep our schools open so that our children can safely learn in person. It also helps keep our economy running so businesses can stay open and people can stay employed and keep working. And expanding our hospital capacity for COVID patients will ensure that our healthcare workers can take care of everybody's medical needs safely. Our administration and the hospital community are working to bring every resource available to continue providing non-COVID care like elective surgeries and routine medical services. But as I said, those resources are finite. We don't want to have to go back to the restrictions that we put in place last spring, and we need everybody's help to make sure that doesn't happen. As the Biden team transitions to the White House, it's encouraging to see the President-elect team focus on COVID on day one. I've said many times that the federal response to this pandemic has been inconsistent at times and insufficient at others. And I hope that a new administration can help remove the partisanship from this fight against the virus. Doing so is critical to keeping schools open for our kids and to keep the economy open and running. We've also received exciting news about the early results of Pfizer's Phase 3 clinical trial for its COVID vaccine. Other companies are reportedly seeing promising results as well. This is obviously welcome news for our country and the world, and in some ways it's a relief to see progress like this, which can and will play a major role in ultimately bringing this pandemic to an end. We formed a vaccine advisory group a few months ago, and that group developed a vaccine delivery plan which has been submitted to the federal government. When the time comes, Massachusetts will be ready to distribute a vaccine. But we still have a long way to go. Until then, everyone needs to remember that we're still living with the virus for at least the next few months. The best defense against this insidious disease comes down to personal responsibility, and we all have a role to play to stop the spread. Before I turn this over to Secretary Sutters, I just want to say one more thing about the election. I'm dismayed to hear the baseless claims coming from the President, from his team, and from many other elected Republican officials in Washington. I've been a Republican for 40 years. I've raised money for Republican candidates. I've knocked doors for Republican candidates. I've answered and made phone calls for Republican candidates. But this latest move to employ the Department of Justice in all of this is so wildly inappropriate. And stalling an orderly transition process, especially at a time like this, is equally unacceptable. I can't think of a worse time to stall a transition than amid a deadly pandemic that the federal government continues to own primary responsibility for responding to. The Trump campaign has legitimate legal challenges. They should bring them to court, and the court should deal with those as quickly and as fairly as possible. But I'm aware of no legitimate claims of wrongdoing anywhere near the scale it would take to affect this outcome, and there's no credible third-party entity that's verified the President's claims in any way. Continuing to make these claims erodes trust in the system to do. And let's not forget, there are Republican elected officials with major roles to play in the vote counting process in many of the states that are in dispute. Anybody who doubts that should take a look at some of Brad Raffensperger's comments, who's the current Republican Secretary of State in Georgia, about whether or not he thinks the process there was above board, proper, and appropriate. Orderly transitions of power are good for the country. They're good for the American people. There's simply no question on this. In every campaign season, we hear a lot about doing what's best for the country. And what this president is doing at this point in time is not in the best interest of this country. The administration needs to move forward and cooperate with the president-elect's transition team immediately.